Okay,
The
recording started.
recording is yes, sir.
Okay, thank you so much and good afternoon, my friends. So today, the last session of this series of on this supply chain management in health sector, and this is we will be discussing Block 4, which deals with the utilization and monitoring of supply chain system. Uh, of, just a moment. Okay, so in this block, we will be covering 5 units. Unit 13, that is utilization review. That is key. Um, we'll be dealing with the utilization review.
Sir, I think your voice is not audible, sir.
Oh. Can you hear me now? Hello.
Yes, sir.
Yes, sir, it is audible, sir.
Okay. Good. Yes, there was some glitch over here. I hope I'm clear. I'm audible to everybody.
Yes, sir.
Okay, thank you. So we will be discussing on the last block in this course on for supply chain management, that is Block 4. And this Block 4, we are having 5 units, starting with unit number 13, which is on utilization review, where we will be discussing key performance indicator, vector vendor rating, supply chain monitoring methods. In Unit 14, it will be Logistic Management Information System, which is more popularly known as LMIS. Their tools, implementation, and case studies, if of course we get time. Then we'll be go to Unit 15, which deals with data analysis and quality control and analytical types of various way, that is health information, centers. Then we are having this total quality management, FMEA. Unit 16 will be having or will be dealing with performance measurement, and Unit 17 will be discussing that regulatory and ethics. So with this, let's start. Sorry. So learning objective for this block, that we'll try to understand the supply chain utilization and monitoring concepts, calculate and interpret the key supply chain performance indicators, describe the vendor rating process and scoring system. Try to understand in detail the LMIS, that is purpose, data elements, software tools, etc. And apply this health information cycle, HIC, to supply chain data management. Yeah, we also try to understand the distinguished descriptive, predictive, and prospective analytics, apply TQM and FMEA in supply chain quality control, compare supply chain framework of various types, that is BSC, SCOR, GSEA, CF, and all, and also describe the role of CDSCO and India's regulatory framework, and discuss business ethics in healthcare supply chain. Let us start with the first one, that is Unit 13, which dealing with the utilization review. Supply chain management have 4 basic key processes. We have discussed time and again in last 3 days, but again, there is no harm repeating it was once again at the beginning. First one is the demand planning. That means forecasting our future needs based on the consumption data, disease burden, and population trends. You have learned that how this demand estimation or forecasting is to be done, because if we don't do it, we will not be able to proceed further and our planning will go hayward. Second is whatsoever items we are having in our inventory, we need to manage that. So it will It is that maintaining optimum stock level, that is avoiding stock outs, on the same time overstocking across all supply chain um, supply chain nodes, whether it is at the store level, it is I mean dispensary level, or the distribution centers. So everywhere we need to maintain this inventory management system. Third, supply relationship management. That means the vendor with whom or the supplier with whom who are dealing with, we need to be evaluating, monitoring, and developing suppliers to ensure quality and reliability. And last but not the least, that is the order fulfillment. That is end-to-end process from order placement to delivery, with that means speed, accuracy, and completeness. So these are the four key processes we need to understand and we need to closely watch and monitor. We are having or dealing or usually practice this six supply chain models. First one is the continuous flow, which gives us the stability and predictability, high demand and low variability products. So for this, we always need to see to it they are having a continuous flow of it, uninterrupted flow of it, so that at in any point of time we are not going out of stock. Second is fast change, that is speed to the market, that is short life cycle and trend driven products. As I was telling, these are the cases where we may be applying that just in time kind of approaches, in which though we are not maintaining a huge stock of it because the shelf life is very low and overstocking may lead us to the wastage of our products. So in these cases, we need to see to it that it is a speed to the market we need to maintain, and we need to see to it maybe in the small group, but on a regular basis we are having it. Then efficient chain, that is cost minimization, that is commodity goods, price sensitive markets. Then agile, that is flexibility and responsiveness. Then custom configured and flexible type. So these are the six basic supply chain models. Now we need to understand the monitoring process, and let us try to understand the definition and benefits. The definition says supply chain monitoring is the continuous tracking and evaluation of supply chain activities, process, and performance to ensure goods flow efficiently from supplier to the end user while meeting quality, cost, and time targets. So, without compromising these facts, we need to see to it that is the activities, process, and performance are there and they are being maintained for the flow of our goods. If we can understand and we can maintain this, the benefits we will be having are the early detection of disruption and bottlenecks. So wherever that problems are arising, so that we the improve the inventory visibility and we can able to control that. Data driven decision making, reduced wastage and stockouts, and accountability at every supply chain node. So these are the benefits things which we can have. The components of monitoring and the 5C framework. What are the five components of monitoring? That is first, or rather it is very easy to understand, what we always say in management, that is input, process, output, and outcome. Input process is that resources what we are having, the budget we have planned, and the procurement we are performing. Process is the storage, transportation, distribution of it. And output monitoring is quantities delivered, timeliness of delivery. So these are the output which we will be reaping if we can maintain our supply chain properly. And outcome monitoring is service delivery impact. That is, are we able to provide the right time in the right place in the for the right patient with the right quality, quantity, and all those things, so that ultimate end users being able to utilize it, use it, and getting the result out of it. So the 5C supply chain are: first is connect, link all supply chain partners digitally, try to be in one loop, collect, rather gather real-time data at every node, no, then communicate that share data across the stakeholders, collaborate that joint decision making, and control act on insight to correct deviations. So these are the 5 C's in this supply chain. And basis on that, if we can try to understand and monitor, the result will be very good. So the monitoring methods are, first is a routine reporting. So this is a very basic kind of thing, and periodic reports from facilities on stock level, consumption pattern, and the orders from the baseline of the which forms the baseline of logistic management information system. And reporting is definitely very important. And it is not only reporting, we are documenting and providing, or rather maintaining these records with us, so that in future, based on that, decisions can be made, the informations can be gathered out of this. Along with that, we definitely need to have the supervision visits, that is physical verification of stock records, storage condition, the cold chain compliance at the facility level. And yes, of course, the separate team or the senior people must make the visit and take care of all these aspects. Third is real-time tracking, that is IoT, that is Internet of Things, GPS, barcode system. These are which will provide the live visibility of the good in transit and storage. So if we can do like this will save lot of our time, which we otherwise will may have to be spending at every level on generating the paperwork, or doing or maintaining that registers and all these things. If we can do it and in a soft copy, we can keep it and very easily can be shared with all our stakeholders. Fourth one is the dashboard analytics, that is aggregate visualization of key performance indicators, enabling rapid identification of underperformance and the trends. So if we are having this data available with us along with that real-time tracking, so somebody can analyze it and can pinpoint where exactly the kind of underperformance is going on, how the trend is going on, and what best it can be done so that the system can be further improved upon. So the key performance indicator categories are, first and foremost is our supplier performance. What we are measuring there, that reliability and quality of supplies along with the suppliers. And example KPI is whether they are being able to deliver the things on time, the rate at which they are delivering, and the defect rate, if at all we are facing those kind of things. So by this we can find out the supplier in performance. Or second is customer services, that is order fulfillment and satisfaction, that is order fill report, OTIF, etc. We are getting out of it. Third is inventory management, is yesterday we discussed in detail, that is the stock efficiency and availability. And by this we can take out, or we can find out what is the stock out rates which we are facing, what is our inventory turnover, whether it is going in the right way or not, and what measures we can take to improve upon. Transportation, that is logistics cost and the speed, and these are the freight cost per unit, transit time. So all these things can be done by the transportation. And last but not the least, that is how good we are in demand forecasting, that is the accuracy of our prediction. And the KPI indicators are the forecast accuracy, that is percentage of MAPE. So don't worry about all these that is abbreviations. At the end of your learning material, a list of these things are being given. So you may go and check all those. Then supplier performance KPIs, that is the formulas. First and foremost, on time delivery rate. That is order delivered on time divided by total orders multiplied by 100. And it should be more than 95% should be our target. That we must ensure that supplier are supplying their supplies on more than 95% time accurately. Defect and rejection rate, the extent to which these defective units are being supplied, and it should be less than 2%. Supplier lead time, that means uh, date of received and date ordered. That's the difference between the when you have placed the order and you are getting this thing. Well, whether this supply is within that lead time period or they are going beyond that lead time period. So it depends on the what the lead time you have given in the contract, because the scarcely available items may be having the higher lead time, whereas easily available items will be a lower lead time period. So accordingly, you and your purchase order or supply order, you will be mentioning the lead time, and against that you will see whether the lead time periods are properly maintained or not. Then purchase price variation, that is actual price minus standard price into quantity purchased. So this should be as minimum as possible, because this is the comparative kind of thing. So we need to see to it maintaining our quality, or the specification which we asked, who is the vendor or who is the supplier who are providing us the lowest cost. Then supplier compliance rate, that is compliant delivery divided by total deliveries into 100, and here also it should be more than 98%. Then next one is the customer service and inventory KPIs. Here the KPI is uh, order fill rate, that means order filled divided by order placed multiplied by 100. Similarly, just a minute. Similarly, for OTIF, that is on time and in full orders divided by total orders into 100, and perfect order rates. So yes, these are the things you may go, read it out, and in your material, these are given in detail. So what we mean to say is this, that is the order which are being given, whether they are, I mean, in whole they are being provided or not, then whether they have been provided in time, and the percentage of order delivered correctly, on time, and without any damage. So these are the things the customer service you have to identify, you have to measure. And inventory management, you have to do the inventory turnover, stock out rates, and days of stock, that is stock in hand divided by average daily consumption. So this will give you the rate at which the things are there, whether we are going for, frequent stockouts, or we are facing the problem of overstocking. So these are the things, these are the indicators which will give us, or which will, help us to understand whether we are going in the right direction or not. Another one is the transportation and demand forecasting KPIs. That is, transportation KPIs are freight cost per unit, how much cost we are incurring into it, on time shipment rate, whether these are being given on time or not, and truck utilization, that is on road when we are having it. So extent to which we are being able to utilize, that is the actual load divided by truck capacity. So whether it has been overloaded, or we are not exactly utilizing this thing, because most many a times the capacity to which it is to be loaded, we are not having enough material available. As a result, with the same quantity, maybe 2 or 3 times the trucks are being used. So these are the transportation KPIs. And demand forecasting KPIs are forecast accuracy, MAPE, and some biases are there. So MAPE is the mean absolute percentage errors, which we may be committing at the time of our demand forecasting. So the extent to which we are doing it and how best we can analyze and see to it that they are not repeated. Next one is this, our vendor rating. That is the concept and importance of the vendor rating. What is vendor rating? A systemic process of evaluating and ranking suppliers based on their performance against defined criteria, that is quality, delivery, price, service, and the compliance. It converts the qualitative supplier observation into quantitative scores for objective comparison and decision making. Why it matters? Because it will help us to identify high and low performing suppliers who are doing better, who are giving better performance and who are giving not so good performance. It supports supplier development program. So we can, the supplier who is not performing, we'll try to find out what are their problems, why they are not being able to it, and let us try to discuss with them and support them so that the performance can be done in a better way. It will reduce the procurement risk. So if we give the support, definitely, of course, ultimately it will be beneficial for us only. Encourage supplier competition and improvement. So whenever they are we competing with each other, obviously the situation will be improving, and those who are lagging behind, we try to pull them up. It provides evidence by base for contract renewals, and that is very very obvious. Who are performing good, obviously we will try to go with them only, and repeated type of orders will be given to them. And those, even after all our support, all our help, they are not coming up well, obviously we have got no other choice but to discontinue with them and find out new vendors. And last is the align supplier behavior with your organizational goal. So they must understand what exactly we require, what is our purpose for having those items, and if they also become a part of it, committed for it, the situation will always be better. So vendor rating and their components and scoring, that is from qualitative to quantitative term, that is a measurable or tangible term what we can have. First is the quality. The weightage is of 30%. That is, we must look into the defect rate, compliance with specs, certifications. So whether the ISO, yeah, or good manufacturing practices. So in those standards, we need to measure them for the quality. Then delivery, that is given 25 percentage of score, and this is whether the on-time delivery are there or not, lead time consistency, order accuracy. Similarly, 20% is given for price or cost, that is competitive pricing, price stability, total cost of ownership. Uh, just a moment, I'm just digressing from the thing. Do you know what is there any difference between price and cost? Because most often we use, I mean, very loosely are the same thing, but there's slight difference. Price is sum total of all the costs plus profit is price, and cost is, that is the individual thing. Take a example of, let's say, a bottle of water, which we always take buy it from market. A bottle of water, that bottle, what we are paying is the price, but at the manufacturer it is the cost of different thing, cost of the water, cost of the plastic bottle, cost of the cap, cost of the packaging, cost of the labor, cost of the transportation. So all these costs are accumulated. Over it, the profit margin is added, and then it becomes price, and that is why you will find MRP, maximum retail price, but never maximum retail cost. Okay, let's come back to our main topic. Fourth one will be service, for which we usually give 15%. That is the responsiveness, after sale support, complaint resolutions, the extent to which the vendor is, doing this or supporting us for this. And 10% is given for compliance, that is the regulatory adherence, documentation accuracy, and ethical sourcing. So, scoring uh, each criteria rated from 1 to 10, and weighted scores summed up, and total vendor rating score, which comes to maximum 100%. So out of this 100%, how much that particular vendor is scoring, and based on that we will be deciding that whether to continue with that vendor in future, or we should, try to find out some other vendor if they are not performing well. So implementation steps are: define the rating criteria and weights, it should be known to them also. Establish data collection mechanism. Set review frequency, whether you are doing it monthly, quarterly, but not more than that. Communicate criteria to all suppliers, obviously, and they should be knowing beforehand that we are assessing them, and these are the things on which we are assessing them. Then score, rank, and share the result with the suppliers, and link score to procurement decision. As I was telling, who are scoring better, we will be continuing with them. Who are not scoring better, first we will try to help them to improve. If they are not complying with us, in that case we have got no other choice but to look for other vendor. But these are all, you can say, nothing bias into it. Everything is there in front of it. It is open kind of thing, a transparent kind of thing. And based on these data, based on this thing, we can always select our vendor, whether to continue with them or to go for the newer one. Challenges and best practices are: challenges, that is inconsistent data. Solution is standardized data collection. Second challenge for this vendor implementation, or this the scoring system implementation, is the supplier resistance. Obviously, many of the suppliers, particularly those who are not performing well, they will always resist this kind of thing. So solution is transparent communication, and make it open to everybody so that they will be having a healthy competition among themselves, which will be ultimately beneficial for us. Challenge of subjectivity. Solution: quantitative metrics. As we have said, that these are the indicators against which we are measuring them, and the weightage been given for each indicator. So that is known to everybody. So there will be no subjectivity. So it will be a kind of an objective, evaluation. Then challenge is for resource intensive. The solution is automate via LIMS or ERP. That is enterprise
Yeah.
resource planning. Yes. Any question?
क्या बेटा बाबू
I think somebody.
क्या बेटा
So can you please mute yourself?
पापा का स्माइल का पापा का स्माइल वो बाबू कहाँ है बेटा बाबू कहाँ है क्या बेटा बाबू वो
Madam, can you ask the participant to unmute himself?
क्या बेटा
Hello, Mr. Vijay. Please mute yourself. Mr.
बाबू कहाँ
Vijay.
है ये बाबू है
Hello, Mr. Vimal. Please mute yourself.
Thank you. Thank you so much. Okay. Then cost and quality management in supply chain. First and foremost is the total cost of ownership. That is beyond purchase price. We also incur lot of expenditure on freight, storage, handling, quality failures, and disposal costs. So we must be aware of this cost also. Cost for poor quality, that is internal failures, rework, wastage, and external failures are returns and recalls, plus appraisal and prevention costs. Another is the quality assurance, that is good manufacturing practice compliance, batch testing, cold chain integrity, shelf life verification at every supply chain nodes, and cost reduction strategies, that is bulk procurement, compliant competitive tendering, standardization, pooled procurement across the facilities. So friends, there will be cost and quality management, and these costs are over and above the known cost or the tangible cost, that is purchase cost, and all those things are there. But other than this, we also incur some hidden cost, or we work with the cost which we can apparently see, but we are incurring those costs also. So we must be aware of these costs and see to it that how best we can minimize all these costs and try to, reduce our cost, or the cost reduction strategies can be applied to help us. Assessment in management metrics are: first metric is gross margin divided by average inventory cost. Second is days inventory outstanding, that is average inventory divided by cost of goods sold. Mainly, these are the things which are being taken from industrial or market sector. Not that all of these are applicable in, and directly, like the EOQ which I was discussing, but a portion of it may be used. By modifying this, we can use it. And we, at this stage, we must understand, or we must aware of this process and practices, so that if anytime we require something, we can take the help of the professionals who are actually having some proper knowledge and understanding, and they can help us out to find out a solution for us. So healthcare context, that cold chain equipment utilization rate, refrigerator uptime and machinery frequency, then vehicle utilization and last mile delivery, warehouse space utilization, equipment replacement and cycle planning. So the asset which are there to help us in supply chain management, we also need to take care of them. We must be aware of the cost incurred for those things, and see to it how best we can utilize these assets, so that our main purpose of uh, making the items available for us, and which is definitely a part of our supply chain. Then digital monitoring and their challenges. That is, the first one is the connectivity gap. Remote facility lacks reliable internet. Real-time data capture is impossible without offline capable system, because we are talking about that in supply chain at every node, not only that from the main store at the state level or district level, but to the till the last mile. There are nodes, and everywhere we need to have these facilities of monitoring and record keeping. Definitely, of course, if it is done online, it will be always better, because it will be quick and easy to share with everybody. But many of the places, maybe due to lack of internet connectivity, lack of electricity, so these things may not be possible. So there we like to have the offline capable system. Then capacity and training. Every health worker need to be digital literacy. Frequent staff turnover leads to data quality degradation. You have trained and you have developed the capacity of a person, but due to our system, because these stores are also sensitive areas, and as a result, as a vigilance measure, we need to make regular transfers, and these transfers have got this collateral problem, that the person whom you have, trained, and you have made him to, handle the things properly. Suddenly he will be transferred, and new person is coming, and if he is not properly trained in it, he might be facing difficulty, and you have spending again more resources and time to train. Third challenge is power reliability, that is erratic electric supply, particularly in those far-flung areas. And fourth is data security. The health supply data is very sensitive and requires encryption, access control, and audit trials should be done on regular basis to prevent its misuse. So we must be aware of these facts and see to it how best we can stop this. Hence, the key takeaway from this unit are that sub-center utilization review involves continuous monitoring of input, process, output, and outcome. So all those indicators we have discussed, against that indicator, we need to do continuous monitoring. Six, supply chain models are from continuous flow to flexibility, which suit different products and demand profiles. Then 5 C framework are connect, collect, communicate, collaborate, and control. Underpins the modern supply chain monitoring. 5 KPI categories are supplier performance, customer service, inventory, transportation, and demand forecasting. Then vendor rating, which converts suppliers observation into weighted qualitative scores. Criteria should be that percentages which we have discussed. Total cost of ownership goes beyond the purchase price, which includes the other hidden costs also, and we must be aware of those and see to it how best we can reduce them. And digital monitoring faces challenges which are the connectivity, training, power, and data security. So friends, this is our unit 13. Let us go to unit 14, that is the logistic management information systems. Here, the LMIS, the concept and definition. LMIS is a very inseparable aspect of supply chain management. If we are not having this, we are blind. We don't know which direction we are going. So hence it becomes a very, very crucial aspect in whole supply chain management system. So definition is logistic management information system is set of tools, paper-based or electronic, used to collect, organize, and report logistic data so that manager can make informed decision about the procurement, storage, and distribution of health commodities. So whatsoever planning we have done, whether we have done it properly or not, whether we are really getting the result out of it, and there should be always a effort from our side, how best we can not only utilize it or make it more accurate, more efficient, and better. So the core purpose is that by this we are actually looking in to ensure right product reaches at right place, the right quantity at right time, a right condition at a right cost. So cost, as always, is a very, very important and crucial aspect, and finance or money is always in short supply. So how best we can utilize every rupee spent and getting the best result out of it. So bridges the information gaps between supply and demand. So that is the main purpose of it. That is the demand or the requirement which we are having. We are managing to have the correct supply against the demand. And this enables evidence-based supply chain management. So evaluation and importance of LMIS. During 70s and 80s, it was absolutely paper-based, ledger-based, and tally cards. So huge book, this what you can files, the registers, and these are to be manually filled. Obviously, this thing not only slows down the process, but due to manual work, sometimes there is kind of aversion and lethargy. As a result, many a times the things are not been properly documented or not properly been preserved. Then came 90s when the standalone PC database started coming in. We are started developing this MS Access, Excel sheets. They started coming in. In 2000s, further into web-based LMIS and early ERP integration. This web-based kind of thing started coming in. More and more online things started coming in. 2010s, that is coming out from PC, we had things started coming in mobile enabled since the time that smartphones came in, and more kind of advancement in the smartphones. Everything started coming in with the cloud-based platforms. And in 20s, where we are now, it is the decade of AI and Internet of Things. Integration. Real-time dashboards are there. Nowadays, there is no delay whatsoever. You are generating that information, you are generating immediately, it can be shared with anybody and everybody. Of course, keeping in mind the security aspects of it, and it is to be shared along with your people only, not to the public. But some other things are need to be made public, and it can be easily done. So it is up to you. You have to decide that which are those information are to be made public and which are the information which are only for internal consumption. So why LMIS matters? Because it prevents stockouts that compromise patient care, reduces wastage from overstocking and expiry, improves accountability across supply chain, supports forecasting and quantification, enables donor and government reporting, and foundation of supply chain performance measurement. Friends, since beginning, it says as army marches on belly, manager marches on information. But gathering information, generating information in olden days were not that easy. That was laborious, time intensive. Whereas at present day, with all this the technology advancement, decade after decade, we are getting better kind of platforms, which was enabling us to do or perform better, generate the information better, and then we have got no reason why these things should not be applied so that we are getting more efficient, more better results. So in the logistics cycle, first is the serving the customer, that is identifying the need for the patients and the health facilities, and this should be the starting point of our logistics cycle. Second is quantification, that is forecasting demand and estimate the quantities needed based on the consumption data and program targets, and how it is to be done we have already discussed in our previous sessions. Third is procurement, that is the purchasing products from qualified supplier at competitive price with quality assurance. Fourth is storage and distribution, that is warehousing under appropriate condition and distribution to the facilities as per schedule. And fifth is LMIS and monitoring, that is for all these activities, whatsoever data generated, those are captured, collected, and analyzed, and a feedback loop to continuously improve the logistics decision. So that is the main thing which LMIS is doing. So hence there are 7 key LMIS data elements. These are stock in hand, that is the quantity of usable product currently available at a facility and most fundamental logistics data point. Second is issues data, that is quantity of product dispensed or distributed from a facility used as a proxy of consumption in LMIS. Third is losses and adjustments, that means extent to which we are still facing the expiry of drugs, damage, pilferage, and return to stock. These are tracked separately to maintain accurate stock in hand records. Fourth, the pipeline status, the quantities ordered but not yet received, essential for avoiding duplicate ordering and stockouts. So we need to see to it that the supply chain, particularly the transportation, within that lead time period, that the agreed upon lead time period is done. If that is not done, maybe we will be facing the stockout situations, or in a hurry, we are going for duplicate ordering also. Fifth is lead time, the time between placing order and receiving it, and it is critical for calculating reorder points and safety stock. And yesterday, if you can recollect, we discussed with this thing that how we are measuring our reorder level and how we are calculating our total safety stock. Replenishment schedule, that is fixed or flexible schedule for resupply, determines when the facility should submit orders and receive their deliveries. And seventh is that order feedback, confirmation of the order receipt, quantity supplied versus order, and reasons for any discrepancy if so happening. Hence, together, these 7 elements provide a complete picture of supply chain status at any facility. The LMIS, that is open source LMIS platform, the overview is that Open LMIS is purpose-built open source electronic LMIS designed for low and middle income countries, developed with USAID support and deployed across sub-Saharan Africa. The key features are the requisition management, order fulfillment, tracking, order fulfillment tracking, stock management, cold chain monitoring, and configurable reporting dashboards. If we or by applying this, what we can gain is free and open source, which reduces cost of ownership. So as this platforms are available free of cost because it is an open source one, so the cost will go down because you are not incurring any cost for this. Modular architecture, configurable by the country. So this is the platform. You can always, readjust as per your own requirement and convenience, for your own convenience. Offline capability for low connectivity settings. There you can have this offline connectivity. Only what all you require is this. You will be having this PCs out there or laptops there in which they can undertake this job. Integrates with DIS2 for health data covering. DIS2 is nothing but health information, district health information 2, and this is nothing but what we are having, that health management information system. The part of it was been developed by Oslo, developed in Oslo, and it is also a kind of an open source thing. And again, this is also used in sub-Saharan Africa. Active global community implementation and deployed in, as is mentioned here, Zambia, Tanzania, Mozambique, and other countries. And you will be surprised to know that 70% of the 70 countries in the world, they are using it, and these 70 countries covering almost 40% of the total world population. So this is a very, very easy and very popular kind of platform which helps us in doing it. So district health information software, that is DHIS2, is the world's largest health information management platform, uses by 70 plus countries, originally built for the health data aggregation. It has been extended with logistic tracker modules for supply chain management. So when the platform is there, at every node, they only need to upload their information, upload their data, not information, the data. And at a central level, somebody is collating it and transforming it into information which can be used for evidence-based decision making. India uses this platform as the national health data platform and integrated with multiple supply chain reporting system. So in our application, it gives us stock reporting at facility and district levels, vaccine stock tracking. I'll be coming into detail of it. That is the cold chain one. Integration with open LMIS for requisition, custom dashboard for program managers. It is very helpful for them for taking that evidence based, conscious decisions into it. Real time alerts for stock outs and expiries, and mobile data entry via the DHIS2 Android app. So these are, available in the mobiles also. So it is not that every time you will be requiring the PC, you will be requiring that net facility. You can do it from anywhere at any center with your mobile in your hand. Coming to this further, this thing that is EVIN and DVDMS. These are the India's vaccine logistics system. EVIN is Electronic Vaccine Intelligence Network. I'm happy to mention that the institute where I spent almost around 4 decades and retired from there as a director, we developed that NCC VMRC, National Cold Chain Resource Management Center. And they are not only training the cold chain, employee technicians across the country up to the district level, but we have also developed this one and made it useful and effective for whole of the country. It is deployed by UNDP India and Ministry of Health and Family Welfare, uses smartphone based stock recording and temperature monitoring across the cold chain equipment. The first time when it has been launched, our Union Health Secretary, sitting in his own office from his phone, he can connect to any district, and from there he can find out what is there. That walk-in cooler, what is the temperature monitoring, going to a district headquarter and seeing it, what are the position out there, and further on they are going the centers below district also. So in total, as of now, covers 28,000 plus cold chain points across India. Real-time alerts for temperature, excursions, whensoever there is any disruption in electricity supply or cold chain machinery, immediately they will start sending alarms. Reduced vaccine wastage significantly in UP when this pilot project was done, and now integral to Indian in Universal Immunization Program (UIP). So it has become a kind of a one of the most crucial component for whole program of Universal Immunization Program. DVDMS is the Drug and Vaccine Distribution Management, Government of India platform for end-to-end tracking of the drugs and vaccines from the central warehouse to the last mile delivery. So this has been done by barcode product tracking at each node. So everywhere it is coming, as you have seen in the supermarkets or where, when they are taking their stock, they are not physically counting. They are just tapping on those items. They're taking the barcode. They have got the number out there. They'll go into the stock position, and from there they can, generate their data. So it integrates with the procurement and finance system, generates automated replenishment alerts and dashboard for state and district health managers. So they just need to enter the data into it. Similarly, it is the e-Aushadhi, and it is the India's drug inventory management system. It is a web-based drug inventory management system developed for India's public health system, used by the state medical stores, district warehouses, and Jan Aushadhi stores. You must be aware nowadays the government of India has started this Jan Aushadhi, where the drug items are sold as per their generic name. No branded items are available there. So while we are using the generic name, so the cost also comes down heavily. Maybe sometimes it is up to 60% also. So this is a huge benefit for a common person, common patient. Of course, the quality aspect is being fully taken care of. It manages the full life cycle, that is procurement, receipt, storage, issue, and expiry management of essential medicines, and for that matter, for all medicine. And this e-Aushadhi, that web-based drug inventory management system, actually looking into all aspects of it. Key features are online indent on the order placement and tracking, batch and expiry data management, that is the consumption of either FIFO or FEFO are enforced for stock rotation, real-time stock visibility across the state, automated generation of consumption reports, integration with procurement and finance modules, and Jan Aushadhi outlet stock management. So everywhere now you need not to really, work for that manual maintenance of records, manual maintenance of registers, giving maintaining those files. These are all been web based, and everything within no time, on as soon as it is generated, it can be shared with all the stakeholders, and conscious and evidence based decisions can be taken at every level. So LMS functions and benefits. The core functions are data collection regarding the stock, records, consumption, orders, data processing, aggregation, validation, analysis, reporting, generating logistic reports for decision makers, feedback, communicating supply decisions back to the facilities, and helps us in forecasting by projecting future commodity needs. And proven benefits are it has reduced stockouts by up to 40 to 60% in LMIC setting. Minimizes wastage from expiry and overstocks, improve facility reporting rates and data quality, enables proactive rather than reactive resupply, and supports accountability and audit trials, and reduces manual workload through automation. So LMIS, these are the main functions and the benefits we are reaping out of it. So 6-step LMIS implementation framework are, first and foremost is the assess, which evaluates the current logistic system gaps, and the key considerations are data flow, reporting burden, existing tools. Second step is designing, that is define data element, forms and workflows. Third is develop, that build or configure the LMIS platform. Fourth, it tests the pilot in selected facilities. They train in capacity building, help us in capacity building, and scale and monitor, that is national rollout with ongoing support. Particularly these are very helpful when are very much effective for our national health programs, which need to be covered whole of the country, every nooks and corner. And this kind of system always gives the project managers or the program managers the correct information at the right time, the earliest possible, so that they can quickly take decisions, make the necessary or required reforms, and try to find out the gap and the solutions for that. uh, LMIS case studies in Ethiopia and Zambia, because both of them are, or rather these countries, as per their own convenience and as per their own requirement, they have developed it. I'll leave it up to you to read it, because in your learning material the details of this are being given there, and they are always showing that success stories by applying this system. There's the other one is for Tanzania and for India, where the pilot study was done in UP, and that is how it has done. That Uttar Pradesh piloted a mobile-based LMIS for essential medicines across 820 community health centers. So what they were giving us, the monthly stock reporting via this smartphone app, stock out alerts sent to the district managers in real time, reporting compliance improvement from 60 to 92%. That much of improvement they could achieve, and reduced expiry drug wastage by 35%. So every system have got its own challenges and own problems. So is with the LMIS also. So the challenges are fragmented system, that multiple parallel LMIS for different programs, poor data quality, implement that is incomplete and inaccurate facility report. Still, our people who are in this system, in this process, they need to pull them up, they need to increase their capacity, they need to do more training and improve upon connectivity and power constraints in the remote areas, inadequate training and high staff turnover, and sustainability of donor funded system post project. Many of these things were started with the funding from the donor agencies, USAID, Bill and Melinda Gates. So many of this kind of CDC, so many of them are there, and due to some geopolitical problems and all these things, suddenly in between, either they are pulling out, or by end of that project they are pulling out, and that the transition to the national system sometimes take undue time, by which either the staff who have been trained are being posted somewhere else, or the system had started focusing on something else, some other program is given priority. So this is the problems which are there, or which are the challenges into it. But to improve upon, our future trends are AI and ML, that is machine learning kind of thing, that is a predictive analytical and demand forecasting, IoT, that is automated stock counting via smart shelf and sensors, blockchains in interoperability, and last mile drones. So these are the things which we are looking up to now, and we are expecting some of those current challenges can be taken care of, it can be addressed more positively, and we will be able to get better results. So the key takeaways are, LMIS, this is collective and organizes and reports logistic data to support evidence-based supply chain. 7 key elements are SOH, issues, losses and adjustments, pipeline, lead time, replenishment schedule, and order feedback. Logistic cycle links with the customer needs through quantification, procurement, storage, and distribution back to data practice. Then we talked about the Open LMIS and DHIS2, for which are the most widely deployed open source platform globally. And we also must take the help of this thing, utilize these facilities to make our system better. India specific tools are Avin or DVDMS, eOshadi, and they are showing good results. 6 steps of implementation: access, design, develop, test, train, and scale. And there are some success stories of this thing and the future to which we are looking upon, that is AI, IoT, blockchain, and interoperable national platforms. So let us see, let's hope these things will give us, better, level of working and better outcomes. But for all this, our staff need to be fully trained, knowledgeable about it, and they should able to interpret, apply and interpret things. I has been told that these are the 2 units on which we need to focus on. So rest 3 units, I should go a bit quickly. I'm not going to that details because I have to cover these 3 things as quickly as possible. So I'll be not going into the details as I was talking for the other these two units. So it is the data analysis, the types and sources. We are having types are the quantitative, qualitative, structured, and unstructured. So these are the data type in our supply chain. Quantitative are the stock level consumption rates. Qualitative are supplier feedback, patient satisfaction, facility conditions. Structured are database records, spreadsheet, ERP data, and unstructured are email reports, photographs, storage conditions, all this. So the key data sources are HMIS or LMIS reports from facility, procurement financial records, supplier invoice, cold chain temperature logs, patient consumption. So these are the sources from which we will be gathering our data. The three types of analysis: the descriptive one, what happened, that is summarizes the historical data which happened past, and from which where we will be developing our next predictions, next forecasting. Then predictive analysis, what will happen. So use the statistical models and machine learning to forecast our future demands. And prescriptive analysis is what should we do, recommend the optimal actions, reorder quantities, supplier selection, distribution routing, use optimization with algorithm and AI. The data analysis tool in supply chain are like common tools are Microsoft Excel, DHIS2, Power BI or Tableau, Python, ERP system. These are the things which commonly been used. Out of this, Microsoft was the old one and ERP is the latest one, where almost all private sector organizations are very much dependent on it. In our public sector, we are slowly and gradually entering into this. And the selection criteria are easy to use frontier health workers. So we need to apply that tool which will be easy for them to handle, to understand and operate. We also need to consider the cost, interoperability with existing systems, offline capability for low connective areas, scalability, and visualization quality for decision support. 6 dimensions of the quality control are: first and foremost is accuracy. How accurate these are in capturing data and physical stock records correctly and reflect no under or over recording. Timeliness, it should be absolutely, there is no point, which the data which you are looking for is not properly done in time, that report submitted and data captured within required time frame only. The delay of any sort is of no use. Completeness, all required data field are properly filled. Many a times this is one issue, that despite of our all effort, or maybe due to work pressure, lethargy, fatigue, so all these things lead to this incomplete data entries. Consistency of the data should be maintained. Reliability, the data which we are feeding should be the reliable one, and it should be relevant data. So these are also the quality indicators or the quality things. So is with the LMIS or on the supply chain also, that is accuracy, timeliness, completeness, consistency, reliability, and relevance. Health information cycle. This is first is create and collect. That is data we need to create and capture. Second is store and secure. So whatsoever data we are collecting, we need to store and see to it that it is secured. That is filing, database entry, backups are there. Particularly the backup is very, very important one. Third is process and analysis, that we are collating and analyzing these reports. Fourth is report and disseminate. By processing, transferring the data into information and keeping with you only, I've got no help. So we need to report and disseminate so that the correct stakeholder or the authority can use it for evidence-based decision making, interpret and use, and archive and dispose. All those data which are useful are to be archived, and those are not of that important. Over the time, maybe that has lost its value. Those are need to be disposed so that you are not carrying a huge data bank with you. Quality control in supply chain management is, that is the quality thing which will be done at every supply chain nodes. First one is the procurement, that is pre-qualification of the supplier, certificate of analysis, product testing. Then second is receiving, that is quantity verification, visual inspection, temperature check. Storage, that is how we are storing it, whether that storing is as per the recommended norms, whether that FIFO or FIFO or FEFO are being properly practiced, pest control measures are taken, distribution, particularly which are there for cold chain maintenance, vehicle cleanliness, delivery verification, and dispensing, that is expiry date check, labeling accuracy, and patient counseling. So these documentation are the, for this we require standard operating procedure, batch release certificate, temperature monitoring logs, non-conformance reports, corrective and preventive actions records, and regular audit and inspection reports. So total quality management for supply chain are the customer focused, total involvement. Every employee should take responsibility and should be accountable for their own job and own the thing for which they are there. Process approach, continual improvement, that is PDCA cycle. That means we need to plan, do, check, and based on that feedback we are getting, we have to act and we make the improvement for the next cycle. Evidence-based decision, because if we are collecting data properly, analyzing them properly, and coming out with proper information, so that will always help us in evidence-based decisions. And systemic thinking, that is quality across an entire supply chain. It is not to be taken as in blocks or in silos. So total quality management in essays, good management, good manufacturing practice compliance throughout manufacturing and storage, ISO certification, zero defect culture, customer satisfaction monitoring, root cause analysis for stockouts and wastage. If they are still happening, we need to find out why it is happening, and benchmarking against national and international standards. We always benchmark all those available standards and try to achieve or try to do better than that. So failure mode and effect analysis are, that is define scope, identify that supply chain process to be analyzed, that is cold chain distribution, map the process, identify failure modes, that list all ways each step could fall, each step could fail, identify effects, rate sensitivity, rate occurrence, and rate detection. So these are again to be scored from 1 to 10 scale. And how serious for rate sensitivity, how serious is the failure impact, rate of occurrence of any such failure, that is how often does this failure is occurring, and rate detection, that is how easy is to detect before the harm occurs. So these are the scoring which we are giving, and we calculate by multiplying this S, O, and D, which prioritize the highest RPN for action. So by this, we can find out, that is where this kind of defects or the deficiencies are occurring, how serious these deficiencies are, and what corrective measures at what level we have to take. So if we can do this thing properly, the defects and deficiencies can be, reduced to a large extent. So real-time data monitoring is from IoT sensors, that is temperature, humidity, and motion sensors, transmit live data from warehouse and cold chain equipments, as I was talking about EVIN, that is electronic vaccine information system. Then we can do it by barcode and RFID, automated identification. That means when the items are received, so by barcoding or RFID, automatically the system will take up, and this will be entered into our system. Mobile reporting, that is frontline workers submit stock report via smartphones, immediate visibility for district manager, and live dashboards. So aggregated KPIs update in real time, and alert triggers automatically when thresholds are breached. So if the system can be put in order, and you will find that this live dashboards will be becoming very effective, and very quickly they can give you the alerts so that you can take preventive actions or you can take corrective measures. So I'm not going into the key takeaways. That is the three analytical things: the descriptive, predictive, and prospective ones. We need to take care of the total quality management, and we need to find out the FEMA things. Then coming to performance measurement. Here, the supply chain performance measurement is, the key terminologies are measure, metric, key performance indicators, and supply chain performance measurement. So why measurement in supply chain performance? It identifies gaps between current and target performance, enable benchmarking against peers and standards, drives accountability across supply chain partners, support resource allocation and investment decisions, and demonstrate value to funders and policymakers. You cannot manage what you cannot measure. It is very true. That means if you are measuring the things properly, if you are aware of your problems, your deficiencies, your difficulties, and if you identify them, only then you will be able to manage it. You can take corrective measures and in due course preventive measures also. So 7 drivers of supply chain performance. First is the facilities, that is the location, capacity of warehouse, and the factories where these are being manufactured. Second is inventory, that means the stock level, safety stock, reorder points, how good you have analyzed and prepared yourself so that you can take proper measures by which you are ensuring no stockouts, on the same time no overstocking, or the minimum stockouts and minimum overstocking to the extent possible. The third is transportation, that is mode, route, carriers, and frequencies. So we also need to measure these performances. Sourcing, that supplier selection and relationship management. How you are selecting your supplier, what are the criteria you are implementing to identify, and how good you are maintaining a relationship. Relationship is absolutely a business relation, no other relationship in this matter. And if some unscrupulous things are going on, we must be aware of that. We should be vigilant about that, and we should see to it those things are taken care of and well in time. Then performance as per the production, that is manufacturing capacity, scheduling, batch sizes. That is, these are particularly going for that make to order or make to stock kind of situations, where you are asking the manufacturer to produce it for you, some tailor-made kind of things. Information, that is data system, visibility, communication, So LMIS platform selection for doing this thing, and we discussed about what are those LMIS platform and what are the things by which we can do this. And pricing, that is cost structure, incentives, transfer pricing, so bulk discount negotiations, and how best we can do it, and fix up a fixed rate contract, and so that this rate issue can be taken care of right at the beginning of the year and throughout the year, that whatsoever you are procuring you will be doing in that same cost only, and the market, fluctuations are to a large extent taken care of. The supply chain performance metrics are divided into four categories. First is the inventory metrics, that is inventory turnover, days of stock, stock out rates, expiry stock percentage. So all these things are the inventory metrics. Logistic metrics taking care of freight cost per unit, on-time shipment rate, truck utilization, order cycle time. So these are the things which are for the logistic metrics. Third is customer order fulfillment, that is order fill rate, OTIF, perfect order rate, order accuracy, and return rate. Then quality metrics, which are the defect rates, supply rejection rate, good manufacturing practice compliance scores, cold chain breach incidents, how often they are happening. So these are the quality metrics we need to be aware of and be scrutinizing them. Attributes for good supply chain metrics, you can use that word SMART, that is specific, measurable, relevant, timely, comparable, and actionable. So it is the same one as I discussed in the previous unit. That is, this attributes should be specific, that is clearly defined, no ambiguity in what is being measured or how. Measurable, the quantifiable with available data, not vague or subjective. It should be relevant, directly linked to our supply chain objectives and decision making needs. It should be timely, available when needed. Historical data has limited value for real time decisions. Comparable, can be benchmarked against peers, prior periods, and national standards. And actionable, that drives a clear management response, not just information of its own sake. Just for collecting the information, you are taking it and then forgetting about it is of no use. So we need to take action whatsoever the information we are deriving out from all this data collection. Quantitative measures are that gross margin and average inventory cost, and purpose is return on inventory investments, freight cost per unit, day scale inventories, days inventory outstanding, days perishable outstanding, purchase price variance. So these are the things by which you can quantitatively measure, and you can take decisions for further corrective measures or further improvement thereon. These are the quantitative metrics, these are the time based one, and these are the cash to cash cycle time, OTIF, perfect order rates, order fill rate, that is lines filled divided by lines order and to 100, that is the percentage it gives. So don't bother about this thing, but know why this are important. The delayed supplies equals to mistreatment opportunities. And definitely, of course, if the items are not available, it is definitely going to hamper your patient care. Longer lead time requires higher safety stock with you, so you must be aware of that, you must identify those scarce items, items which are scarcely available, and that is why you should keep a longer lead time period, and during that lead time period you must have enough stock available with you as your safety stock. So that calculation need to be done. Then C2C, that is the cash cycle time, affects cash flow for health facilities. OTIF is the gold standard for distribution performance. Then POR captures the true end-to-end quality of an order. Then qualitative supply chain performance metrics are non-promoter scope, custom value ratio, customer satisfaction surveys. So I'm not going to the details of it. The details are very nicely explained in your learning material. Then coming to the supply chain performance framework overview. The most popular one are these four, that is balance scorecard, BSC, four perspectives, that is a financial, customer, internal process, learning and growth against supply chain matrix to strategic goal. So this is a system by which we are doing it. SCOR model, that is supply chain operation reference, standardizes framework with 6 processes: plan, source, make, deliver, return, and enable. These are the 6 processes on which this model is made. GSCF, that is Global Supply Chain Forum, 8 cross-functional business process linked with linking, that is supply chain partners for integrated management. And performance of operation model and performance of operation and administration model, that is the 7-dimensional framework for public sector health supply chain. So this first one, that is BSC, have got 4 perspectives: financial, our customer, internal process, and learning growth. The SC focus is on cost efficiency, return of interest. For the customer, it is service level satisfaction. For internal process, operational efficiencies. And for learning and growth, capability and innovations. So the key principle of this is ensure that BSC ensure that supply chain performance is not evaluated on financial metrics alone. A supply chain may be cost efficient but still failing customers or not developing its workforce. So BSC reveals a full picture, and that is giving you the holistic thing of it. That is, it is not only based on the financial matters, it is the customer satisfaction, operational efficiency, and capability and innovations are also also taken care in this system. In healthcare benefits and implementation, 5 benefits of healthcare, that BSC healthcare supply chain. It translates strategy into measurable SC targets, balance short-term cost control and long-term quality, improves communication across supply chain departments, enables early warning of performance deterioration, and align procurement, logistics, and clinical goal. So 9 steps of implementation. It defines the supply chain strategy, identify strategic objectives, select key performance indicators for each objective, set target and baseline, assign ownership, who will be doing or who will be performing what role, build the scorecard tool, collect and report data, review the performance regularly, refine and update the scorecard. So that is how it becomes so helpful for the supply chain managers. In SCOR model, the 4 components are performance, processes, practice, and people. Performance is standardized metrics across 5 attributes, that is the reliability, responsiveness, agility, cost, and assessment management efficiency. The process part is standard definition for SC activities, enables common language across organization and benchmarking. In practice, industry best practices for each process, from basic to advanced and innovative approaches. And for people, that is the skill, competencies, and training requirement for supply chain role at each process level. So these four components are taken and six core processes are done. That is plan, source, make, delivery, return, and enable. So in plan, it is demand and supply balancing, supply chain strategies. In source, procurement, supplier management. In make, manufacturing and production. In delivery, order management, transportation and description, distribution. Return, that reverse logistics, return management, and enable supply chain governance and data management compliances. So these are the things that is the score on the digital standards 22 adds two processes, that is sustain, that is sustainability, and orchestrate, that is ecosystem coordination. So these are the two things which added, at 2022. GSCF framework, that is 8 business processes, that is customer relationship management, customer service management, demand management, order fulfillment, manufacturing flow management, supply relation management, production development, commercialization, and return management. So these are the cross-functional integration linking supply chain partners through shared process rather than transactional relationship. So it is kind of a coordination and which helps that every stakeholder will be on the same page. They all collectively try to improve upon, and this data will be help the supply chain manager to not only monitor but to develop their own system more robust and more effective. Then POA model have got 7 dimensions: availability, quality, cost, efficiency, sustainability, capacity, and equity. In availability, as it says, the product available at the right time, at the right place, at the right quantity, and all those rights. Quality, that product meets the required quality standards. Cost, at the efficient use of resources across the subcenter. Efficiency, the output maximize the relative to input users. Sustainability, long-term viability, and capacity, that human and infrastructure capability, and equity, fair distribution of health commodities. So this performance operation administrative model is designed specifically for public sector and health supply chains, measuring performance across these 7 dimensions. So friends, the key takeaways of this unit 16 is measure metrics and key performance indicators. The good metrics are specific, measurable, relevant, timely, comparable, and actionable. And these are the 4, this things, that is BSC, SCOR, GSCF, and POA. Coming to the last one, that is regulatory framework and business ethics. Sorry. So CDSCO, that is the role and mandate. CDSCO is nothing but Central Drug Standard Control Organization, is India's national regulatory authority for drug, cosmetics, diagnostics, and medical devices under the Ministry of Health and Family Welfare. This is headed by Drug Controller General of India, DGCI, and vision is to protect and promote public health by ensuring the safety, efficacy, and quality of medical products in India. Core mandates are regulatory control over import, manufacture, distribution, and sale of drugs, approval for new drugs and clinical trials, licensing of blood banks and vaccine manufacturing, setting standards for drugs and cosmetics, post-market surveillance and pharmacovigilance, and coordination with state drug regulatory authorities. The organizational hierarchy are that DGCI as the topmost, what you can say, executive person, manager. Under him, 2 deputy, there are the deputy DGCIs, assistant DGCIs, medical device division, diagnostic division, drug inspectors, and technical data associates. The CDSCO e-governance and Indian global role. E-governance initiatives are Sugam Portal, the online platform for drug approval, application, licensing, and regulatory submissions. ONDLS, that is Online Drug Licensing System, streamline the approval process. CTD format, that is the Common Technical Document, harmonized with international regulatory standards. And this reduces approval timelines and improve transparency. So Indian pharmacy of the world supplies almost 50% of the global vaccine demand, provides 40% of the generic drugs consumed in USA, 25% of all medicines supplied to UK, largest provider of generic medicines globally, over 3,000 pharma companies and 10,500 manufacturing units are under control of this, and strong regulation framework underpins the export credibility. Briefly about Drug and Cosmetic Act of 1940 overview, the objective is regulate the import, manufacture, distribution and sale of drugs and cosmetics, ensure drugs are safe, effective and of standard quality, prevent adulteration as misbranding, and protect consumer from spurious and standard products. Salient features are central and state dual regulatory structure, Schedule A to Y covering quality standards, prescriptions, good manufacturing practice, and clinical trials, licensing requirements for manufacture and sale, provision of drug testing and quality control, penalties or offenses that which include imprisonment, fine, or both, and amended multiple times. Recent ones were 2008, 2014, and very recently 2020. So these are the schedule of drugs under Cosmetic and Drugs and Cosmetic Act, and I'm sure you people are aware of this schedule system, which demarcates which are the drugs at what level it is to be sold under the prescription or over the counter and all these kind of things. New Drugs and Clinical Trial 2019, the key features which replaces Schedule Y of D&C Act Drugs and Cosmetic Act 40 with a comprehensive standalone rule, 13 chapters covering all aspects of clinical trial and new drug approval, 8 schedules providing technical guidance, amended in 2024 to align with global ICH guidelines, accelerate approval pathway for orphan drugs and rare diseases. Key provisions are ethics committee registration and oversight mandatory, informed consent requirements, strengthen the and their strengthening, compensation for trial-related injured specified, waiver of locally conducted phase 3 trial in some cases, post-market surveillance requirement defined, and audiovisual documentation of the consent process. These are the new things which have been added. Amending the previous one, that is the existing Drug and Cosmetic Act 1940. That pharmacovigilance performance for India. Pharmacovigilance monitored the safety of medicine post-marketing in India, launched in 2010 by Ministry of Health and Family Welfare, and coordinated by National Coordination Center at IPC Ghaziabad. And the functions are to collect and analyze adverse drug reaction, signal detection, issue the drug safety alerts, communication, recommended regulatory actions, train healthcare workers, and adverse drug reaction reporting, contribute Indian data to WHO Global Pharmacovigilance. Material vigilance and healthcare subcenters. There is a material vigilance is another system which is in practice in our country. I'm not going to the details of it. Pharmacovigilance performance in India. So it is almost the same thing which I discussed. Newer drug trials. I don't know somehow. Oops, sorry. So, the key takeaway from Unit 17, that is CDSCO, is India's apex drug regulatory headed by DGCI with a 7-level hierarchy, e-governance tools, which are the Sugam portal, on DLS, CTD format, which helps us or further streamlines and bring in the transparency. India supply to a large extent, to a greater extent, to the global countries, including US, UK, and other developed countries. We discussed about Drug and Cosmetic Act 1940, the new drug and clinical trials, pharmacovigilance, medical device rules 2017, and the business ethics, patient welfare, fair procurement, responsible sourcing, and regulatory compliances. So, friends, with this, we come to the end of block 4. The unit 13, the which dealt with the the supply chain monitoring. Unit 14, that um, LMIS, along with that 4 data elements. Unit 15, 3 analytical types, which mainly concerned with the quality. Unit 16, that same 7 supply chain drivers, and 18, which are, that is, our DGCA or the drug controller things, and the various acts, pharmacovigilance and all. So these are the key acronyms or the things which are given in your learning materials also, and the full details are given. So with this, I stop here, and that we have completed this course on supply chain management. And if anybody having any question, query, or any comment to offer, you are welcome. Over to you.